everybody, and welcome to this HealthFlex webinar today. Today we'll be talking about Annual Election 2024. My name is Kelly Whittick, and I am the Director of Health and Wellbeing at WestPath. Thank you for joining us here today. So as I hope you know, annual election is November 1st through 16th, so that starts very soon. We want to make sure that between now and November 1st, when annual election starts, you are visiting Alex Benefits Counselor. You can find your link, your special link to Alex right in Benefits Access. So if you log into Benefits Access and click the Annual Election Learn More button in advance of November 1st, you should be able to access your Alex tool anytime. Of course, between November 1st and 16th, we want to make sure that you get in there and you make your 2024 elections. This is your time to choose your plans, which dependents you want to cover, and what account contributions you might want to make to a flexible spending or health savings account. So very important to take the time to make an active election and make sure your choice reflects your wishes for 2024. If you don't make elections during annual election this year, during that November 1st through 16th time period, you will be enrolled in the same plans as you are this year if you're already enrolled, unless you're enrolled in an HSA plan, because as you'll hear today, all of our HSA plans are changing. So if you're enrolled in an HSA plan, you're going to get enrolled in the most similar, most appropriate HSA plan that most closely matches what you have today. And either way, you won't have any personal FSA or HSA contributions. If you are newly eligible for 2024, you will be enrolled in your plan sponsor's default plan. So even if those are the right plans for you, you want to get in there and make sure that you get the elections you want and hopefully make some personal contributions as well. Now, maybe you've done this annual election thing many, many times and you consider yourself an expert, but even if you've done it many years in a row, we want to make sure that we call out a few things for you this year. First of all, as I said, all of the HSA plans are changing for 2024. If you're enrolled in an HSA plan currently, you received an email inviting you to attend a webinar on the 23rd of October, so this Monday, and hopefully you attended that. If you didn't, you would have received a follow-up email inviting you to listen to the recording. We hope that you will take advantage of those opportunities to really understand those HSA plan changes for 2024. If you're one of the 7 annual conferences that currently sponsors a United Healthcare plan, your network will be changing for 2024. So all of the HealthFlex plans will have Blue Cross Blue Shield as the nationwide PPO network in 2024. So if that's you, you've received some direct communications about that as well. Everybody will get a new ID card in December. So everybody who enrolls in HealthFlex for 2024 will get a brand new ID card. Make sure you use the card you have for the remainder of 2023 and make sure that you have that new card ready to use for claims starting on January 1st. And then finally, we have a brand new care coordination program powered by Quantum Health that we're rolling out in January, and we are so excited about this because we really believe this will give you all a much higher level of care and support in 2024. So we're very excited. I hope you're excited too, and you'll hear a lot more about that in December and January. So stay tuned. Okay, so even if you are an expert, hopefully that has been helpful information, and if you're not considering yourself an AE expert, well, I have some more information to share with you today. So today we're going to talk about a little bit about a HealthFlex overview. I'm going to walk you through all of the different plan options on the medical side, the dental side, and the vision side. I'm going to review the premium credit and remind you what that is, or tell you what that is if you aren't familiar with it already. We're going to talk about different types of health accounts and which types of plans they're paired with. We'll talk about the decision support tools that WestPath provides to you in order to make it as easy as possible for you to make your elections this November. And then we're going to actually talk about how you go about making those elections. So here we go. You may have seen all sorts of these terms in the past: co-insurance, co-payment. Health benefits are filled with various jargon. So I'm going to start this webinar out by telling you what I mean when I say some of these different terms. I'll try not to use too many acronyms, and hopefully together we'll be able to get you the information that you need. So coinsurance and copayment describe the type, like how much of the total cost of the service that you're responsible for paying. And that's dictated by the plan that you enroll in. So coinsurance means that you're responsible for a percentage of the total amount. And copayment means that there's a flat dollar amount that you're responsible for paying. An explanation of benefits is something that Blue Cross Blue Shield or in the past United Healthcare provide that really explain how your insurance processed the claim. So you will see how much was billed and then how much your share is. When I say formulary, that means the list of prescription drugs which OptumRx covers at the request of HealthFlex. And we'll talk a little bit about brand drugs versus generic drugs, but both brand and generic drugs are on the formulary, and a drug needs to be on the formulary to be covered by the plan. The deductible is a chunk of money that you're responsible for paying before the plan starts paying for certain types of services. So all of our medical plans have deductibles that apply before some of the major services like inpatient hospitalization or outpatient surgery, before the plan starts to pay for those things. Your out-of-pocket maximum, that's the maximum amount that you pay for covered services for medical, pharmacy, and behavioral health services. So when you hit that out-of-pocket max, that you don't pay any more as long as you're accessing covered services from an in-network provider. Premium credit we'll delve into, but that's the fixed amount that your plan sponsor gives you to help you pay for your HealthFlex plan. And the premium is the amount that we charge each month in order to enroll you in the plan. We also have HMO and PPO. Those are different types of plans. The vast majority of our plans are PPO plans, or preferred provider organization, and that means you can seek care outside of the preferred network, but you get much better coverage if you use a provider that's in the preferred network. The HMO only applies to one of the dental plans, the dental HMO, and that's a narrower network as well as a more restrictive network, which means that you cannot get service outside of the network if you're in the dental HMO. And then we have some health account terms, and so we will go over these in detail, but the FSA is a flexible spending account. We have both a health and a dependent care flexible spending account. The HRA is a health reimbursement account, and the HSA is a health savings account. So lots of different acronyms and terms there. Hopefully that was a helpful review, and we're ready to move on to the next bit of information. Well, HealthFlex is a plan that really partners with a lot of top providers out there in this marketplace. New in 2024, I mentioned we'll be partnering with Quantum Health. They will be providing our care coordination service. We partner with Blue Cross Blue Shield. We partner with Blue Cross Blue Shield of Illinois because we are in Illinois, but we're able to access their entire nationwide network in order to serve all of you. We partner with OptumRx for pharmacy benefits, VSP for vision, Cigna for dental. We use MD Live for telemedicine benefits, so that's like virtual care. And we partner with Health Equity to provide all of our health accounts like FSAs, HRAs, and HSAs. With those partners, we're able to provide some very broad network access. So just wanted to make sure everybody understood every single plan, every single medical plan uses the same broad nationwide PPO network through Blue Cross Blue Shield of Illinois. So that's a very comprehensive network. Lots of providers and hospital facilities are included in that network. And all of our plans use the same formulary through OptumRx, which means the same retail pharmacies are included and the same medications are covered, regardless of which plan you choose. There are also what we consider some bonus benefits that are included in every single HealthFlex plan. The first is our well-being programs and incentives. And for those of you who have been with us for some time, I hope you've taken advantage of those. We have a comprehensive set of well-being programs and some financial incentives that we offer to go with those. We have activity tracking through Virgin Pulse, biometric screening through Quest, health coaching for Virgin Pulse, diabetes prevention and management programs through Omada Health, emotional health support through MD Live and Optum EAP, and far more. And you can earn up to $410 for both the participant and the covered spouse in HealthFlex, just for participating in various wellness activities. We also asked you earlier this year to complete the health check questionnaire, and if you did that, then you'll have the lower deductible amounts that we share in this presentation today. And I mentioned before, we're introducing a new care coordination program through Quantum Health in January. So this gives every individual, every family, a team of nurses, a team of benefit experts, people who are experts in claims, and they can answer basically any question that you have, and at a much deeper level than we have been able to at WestPath. They have different expertise and they have different access to information. They are the number on the back of your ID card. So they are going to be able to provide a ton of support to you and really just make healthcare a little bit easier. When you're choosing your HealthFlex plans, I hope that you've noticed that we do offer multiple options. You know, there are 6 different medical and pharmacy plan combinations, up to 3 dental choices and 3 vision choices, which really gives you a lot of flexibility to pick a plan that's a good fit for you and your household. Depending on your own risk tolerance, depending on how much money you have saved, a different plan might be a better fit for you. But we don't leave you to your own devices to choose those plans. We have tools like Alex Benefits Counselor. OptumRx is rolling out a pricing tool. We have plan comparisons and other detailed materials and videos and webinars that are available to really make it easier for you to choose the plan that's right for you. All right, let's dig into the medical and dental and vision plan options next. So in 2024, we still have 6 medical, behavioral health, and pharmacy plans. And you might recognize our little apples. They're the same little apples. We do have 3 new plans. The HSA plans are new for 2024. We have our new H2000, which is different than our current H2000, an H2500, an H5000, our 2 HRA plans, the C2000 and C3000, those are the same. And then we have our B1000. We have 3 dental plans. If you are in a zip code that has HMO dentists, you'll have access to the dental HMO. Otherwise, you'll definitely be able to see both the passive and the regular dental PPO. We have 3 vision plans. The Exam Core Vision Plan is a no-cost plan, so as long as you enroll in medical, you can have the Exam Vision Plan for no cost, no additional premium. And then we have 2 buy-up plans, the Full Service and the Premier plans. And then we have this suite of health and reimbursement account options, the health savings account, the health reimbursement account, and then 2 types of flexible spending accounts. All right, let's dig into the medical, pharmacy, behavioral health plans first. As I mentioned before, in 2023, we had a set of 3 HSA plans. In 2024, we'll be replacing those with 3 different HSA plans that are fairly comparable and a better fit for what the IRS requires and the long-term sustainability of those plans. So we'll replace the H1500 with the new H2000, the H2000 with an H2500, and the H3000 with an H5000. And remember, there were specific webinars and communications that delved into the details of those plans, so I won't be going into a ton of details about those plans today. So how do HealthFlex plans work? Well, all of the HealthFlex plans have a deductible, and that's the phase where you are responsible for 100% of the discounted cost of the various services you receive. And when I say discounted costs, it's because sometimes a provider will bill an amount and they'll have a contract with Blue Cross Blue Shield that says, hey, since you're with Blue Cross Blue Shield, we're going to charge you less. So they might bill $100 for a service and then have an agreement with Blue Cross Blue Shield that they'll accept only $70. In that case, you would be responsible in the deductible phase for the full $70, not the full $100. Once you've met the deductible, the plan pays part of the services. So let's say we have that same $70 service, and now you're in the co-insurance phase because you've already met your deductible. Well, now you might only be responsible for 20% of that $70 or 30% of that $70, depending on which plan you choose. During that deductible and co-insurance phase, you can use your health accounts, your flexible spending accounts, your health reimbursement accounts, your health savings accounts. You can use that money to help pay your responsible costs. Once you hit the out-of-pocket maximum, then as long as you're seeking covered services, covered medications, covered physician visits, covered hospitalizations, you don't pay any more. So there's an individual out-of-pocket maximum that's $5,000 for one individual or $10,000 for a family, and that's the same for all plans this year. So in the past, we had one plan that was different. For 2024, all of the plans have the same out-of-pocket maximum. There are some plans that have co-payments that kind of sit outside of this structure. So co-payments like in the B1000 for office visits or in some of our other plans for prescription drugs, co-payments could be due either before you've met your deductible or after you've met your deductible, but not once the out-of-pocket maximum has been reached. As long as it's a covered service, the out-of-pocket maximum is a cap and you don't pay anything additional after that. It is important to remember, though, that co-payments do not count toward the deductible. So only things that you're paying in full count towards that deductible. It's also important to remember that these terms, deductible, coinsurance, out-of-pocket max, they're different for the dental and vision expenses. So there are deductibles and maximum benefits for dental and vision, but they don't combine with the medical, pharmacy, and behavioral health deductible and out-of-pocket max. All right, well, let's talk about how all these plans are similar, because sometimes when we see so many plan choices, we say to ourselves, how am I going to decide between them? But there are some things that are the same regardless of which plan you choose. For instance, you can choose which doctor you want to see. In or out of the network, we certainly encourage in-network, but you can see the doctor or provider of your choice, and you don't need a referral to do that. Same for all the plans. Every single plan has access to the nationwide Blue Cross PPO network, which means if your doctor is in network with one of these plans, your doctor is in network with all of these plans. Same for the OptumRx premium formulary. If your medication is covered by one of the HealthFlex plans, it's covered by all 6 of the HealthFlex plans. So you don't have to worry about checking to see which plan covers which doctor or which medication. Every single one of our plans is going to have access to those care coordinators in 2024, which we hope makes your health journey and your healthcare experience a whole lot easier. We have the same comprehensive well-being programs and incentives for all plans, and then we have the same $0 cost for MD Live, and that's true for both the acute medical care, like if you have an ear infection, or the behavioral health virtual visits, and that will be at least through the end of 2024. So when you start comparing the plans, I want to emphasize that the higher monthly premium doesn't make a plan a better plan. You get the same quality and the same services on every single plan, and the truth be told, the most expensive plans are not the best for everyone. In fact, we find that over 90% of our population would save money if they enrolled in an HSA plan. Now, we know HSA plans aren't for everyone, and we know the lower cost HSA plans aren't for everyone. But I just want you to keep that in your mind, as you know, if you're defaulting back to that B1000 or the C2000, which you've always been in, take a look at the HSA plans this year, because 90% of HealthFlex participants and households would be better off financially in an HSA plan. So if you want to save money on health care and health benefits in 2024, we just ask you to consider all of these things: how much you pay in premium each month to be on the plan, how much we put in a health account on your behalf for the different plans, and your out-of-pocket expenses like co-payments and co-insurance and deductibles. You want to consider all 3 of those things and then add them together when you try to decide which plan is going to be the best for you. Now, Alex kind of does that for you. So if you don't feel like pulling out the Excel spreadsheet and doing it yourself, Alex will do that for you. But if you want proof, if you want to be able to spell it out yourself, you know, I've been known to do that in an Excel spreadsheet and put my premium, my health account contributions, and then my out-of-pocket estimates, and really look side by side and see which one makes the most sense. You can use past year explanation of benefits to help figure out how much you're going to pay out of pocket or how much the discounted cost is for a service. So if you go see a cardiologist every year and you see that every year that visit comes back and the total allowed amount or the total discounted amount is $1,500, then you know that's what applies to the deductible and the co-insurance depending on which plan you choose. And again, use Alex. Alex is a great tool. It can be used not only to estimate which plan will cost you the least, but also how much you might want to contribute to a health account. And if you choose a lower cost plan and save some money in premium each month, we strongly encourage you to take that money and contribute it to your HSA or your FSA. If that's money you're saving and you put it in one of those health accounts, particularly a health savings account, which is yours forever, then that just helps you feel more confident at meeting some of those higher out-of-pocket expenses. All right, we talked a little bit about how the plans are similar. Now let's talk about how they're different. So we bucket our plans into HSA plans. We have 3 of those, HRA plans, 2 of those, and then the B1000, which is kind of a traditional PPO plan. So how do these different types of plans handle doctor visits or urgent care visits or ER visits? Well, the B1000 behaves differently in this case. It has a fixed copayment for doctor visits, a little bit different for primary care versus specialist. It has a fixed copayment for urgent care and a fixed copayment for ER. But it's also the most expensive plan, so you're going to pay the most in premium for it to be on the B1000 each month. The HRA and HSA plans, however, you have to meet your deductible first, and then you pay the coinsurance that's dictated by the plan. For medications, the deductible only applies in the HSA plans, and that is an IRS requirement. So there are certain medications, like preventive medications, which we'll talk about later, that do not require you to meet the deductible first, but that makes the HSA plans a little bit different than the HRA plans and the B1000. The HRA plans and the B1000, you just go right to paying a copayment or coinsurance. Behavioral health office visits. So that works a little bit differently per plan, and to be honest, we just tried to make behavioral health office visits as accessible as possible for everyone. In the B1000, it's a fixed copayment. In the HRA plans, the C plans, you pay coinsurance, but you don't have to meet the deductible first. And in the HSA plans, again, IRS requirement, you have to meet the deductible first, and then you can, and then the plan pays its coinsurance. An exception to that, of course, are MD Live behavioral health visits. Those are available to you through 2024 at $0 cost share for all plans. So different health accounts are permitted for different plans. The HSA plans, the green plans, they start with H. Those are the only plans that you're allowed to contribute to a health savings account. They are qualified high deductible health plans qualified by the IRS, and so you're allowed to contribute to a health savings account. If you also want a flexible spending account, it has to be limited use, which means dental and vision services only. The HRA plans have a health reimbursement account, and you can also contribute to an FSA, flexible spending account. The B1000, you can only contribute to the flexible spending account. The deductibles also work a little bit different for some of our plans, particularly the H2000 and H2500. So I want to walk through that today. So let's compare the C2000, which is one of the HRA plans, to the H2000, which is one of the HSA plans. So if you cover one person in either of those plans, the deductible is $2,000. So you meet your $2,000 deductible, and then the plan starts paying 80%. Where these plans differ is if you cover family members in the plans. So in the C2000, if you cover multiple people and only one person has expenses, that person's deductible is still only $2,000, and then the plan pays its 80%. However, with the HSA plans, with the H2000 and the H2500 HSA plans, the family deductible always applies, which means even if only one person has expenses but multiple people are covered, that person's deductible will be $4,000, and then the plan will start paying 80%. Now, the out-of-pocket maximum for that one person is still $5,000, so once they meet that deductible, they only have $1,000 more in expenses before they've met their out-of-pocket maximum. For family coverage where multiple people have expenses, in the C2000 example, each individual has a $2,000 deductible, but the whole family together only has a $4,000 deductible. So if you have, multiple family members and one person hits, $1,500 and the next person hits $1,500, the next person only has to do an additional $1,000 to hit that $4,000. They don't have to get all the way up to $2,000. In the H2000 plan, if multiple people have expenses, they all work together to meet that $4,000 deductible, similar to the C2000, and then the plan kicks in. So the main place that it's different is if you cover multiple people, but only one person has expenses. Now the H2500 behaves similarly to the H2000, and the other plans behave similarly to the C2000. Remember, the out-of-pocket maximum always applies, so no one individual has to pay more than $5,000 for covered expenses, and the family doesn't have to pay more than $10,000. You can always use your HSA contributions to offset that higher family deductible. And truthfully, most families have many people contributing to the deductible, and prescriptions count toward the deductible. So just because that family deductible applies, it isn't a reason to kind of write off that H2000 and H2500 plan. Let's do another comparison. So here we're going to look at the C3000 and the H5000. So these are the two lowest cost plans for the HRA category and the HSA category. So in the C3000, if you have just one person covered, it's a $3,000 deductible, and then the plan pays half and you pay half until you reach the $5,000 out-of-pocket maximum. For the H5000, if you cover one person, they pay everything until they hit that $5,000 deductible, but then they're done. They've also hit their out-of-pocket maximum. So that's a bit of a simple plan if you think about it. Each person only has to meet up to $5,000, and then the plan pays 100%. Now, if you cover more than one person, the C3000 applies similarly to the C2000. So if one person has expenses, they still have to meet that $3,000 deductible, and then the plan pays half. The H5000 is also similar, that even if you cover multiple people, once you've met that $5,000 deductible as an individual, you've also met the out-of-pocket maximum. So now the plan pays everything. If two or more people have expenses under the C3000, each only has to meet up to the individual deductible, but together the family only has to meet the family deductible, which is $6,000 for the family, and then the plan kicks in. And if two or more people have expenses in the H5000, they each pay up to the $5,000, but only up to $10,000 for the whole family, because that's the out-of-pocket maximum for the family. So once the family hits $10,000, the family is done. And, you know, I'm sad to say that sometimes those years happen, and they are typically rough years with a lot more expenses than just $10,000. So again, remember, the out-of-pocket maximum always applies, and you can always use your HSA contributions to help offset that higher deductible. And in fact, we encourage that. So we have a QR code now on the screen, and hopefully you've seen this comparison before. We attach it to many of our emails, and it's also available in Benefits Access. So this plan comparison brochure provides very detailed comparisons of how much each plan covers, what the deductibles are, what the co-insurance is, when co-pays apply. So take the opportunity, scan this code, take a look at your emails coming up for AE. This will certainly be in there because this is really a great tool to use to compare the different plan choices. I also wanted to talk a little bit more about HSA plans and medications. So I mentioned to you before that the HSA plans, you do have to meet the deductible before the plan starts to pay a portion of the medication costs. And again, this is an IRS requirement, not something that WestPath dictated. But we do put some things in place to try to help you, if you choose an HSA plan, to save some money on your medications. First of all, HealthFlex gets drug rebates from manufacturers. OptumRx passes any rebates that they receive directly back to WestPath. And historically, we've used those to help offset the premiums so that we don't have to pay as much to be on healthcare coverage. However, we also give you credit for the value of that manufacturer rebate when we're calculating the copayment or the co-insurance that you need to pay. So just know that the discounted cost already includes an offset for the rebates that we receive from manufacturers if in fact your drug is rebate eligible, which not all drugs are. We also have implemented this preventive drug list. So not all drugs are subject to the deductible in HSA plans if they're considered preventive. And to be honest, we don't get to pick what's on the preventive list. OptumRx determines that based on information that's out there in the industry. But there are a ton of different types of maintenance medications that are on that list, including antidepressants, some diabetes medications, some cardiovascular medications, some clotting medications. So take a look and see if your medications are on that preventive list. You can find the current list at welcome.optumrx.com/WestPath. And looking at that list, if it turns out that a lot of your medications are on that list, then you don't have to meet the deductible before the plan helps you pay for those, even if you choose an HSA plan. So definitely worth noting. Let's do some comparisons of different types of medicines to talk about how much you might pay for different medications in the different HealthFlex plans. So this example is a generic medication that's not on the preventive drug list. So the full price of the medication, of course, discounted by OptumRx, for a 30-day supply is $110. For a 90-day supply is $330. If you are in the B1000, the C2000, or the C3000, if that's what you elect for 2024, then you will pay a copayment. It's a generic drug. It has a copayment in these plans. So it's a $10 copayment for a 30-day supply, a $25 copayment for a 90-day supply. Now remember, for your HSA plans, since this is not a preventive medication, you have to pay the full discounted cost of the drug. And that may be scary, but please also remember that you may be paying less each month to be enrolled in that plan, or you may be getting money in a health account to help offset the costs incurred in that plan. So please consider all of that. Once you've met the deductible, those same copays as the B1000, C2000, and C3000 actually apply. The H5000 is the same in this case as the H2000 and H2500. Of course, in this case, when you meet the deductible, you've also met your out-of-pocket maximum, so then you're done and you don't pay anything for those medications for the rest of the year. Now, what if that medication was on the preventive drug list? So same medication, same prices. Same thing in the B1000, C2000, and C3000, right? We're already paying co-payments for that. But now we're doing the same co-payments in the HSA plans because this medication is on the preventive list. And remember, we provided the link to the preventive list. It's a great place to go and look. And if you followed the details to the pricing tool in Benefits Access, you should be able to find that list, even if you didn't jot down this link fast enough. Now, what if we're on a preferred brand medication? So brand medications tend to be more expensive, right? Brand medications have one source typically, whereas generics can be made by multiple manufacturers, so there's competition there. So let's say this is a preferred brand drug, but not on the preventive drug list. They're typically more expensive, so in this example, we said a 30-day supply is $267, a 90-day supply is $726. In the B1000, C2000, and C3000, it's a 30% coinsurance for brand medications on the preferred list. However, there's a maximum. So if your medication is more expensive like these are, you don't pay any more than $65 for a 30-day supply or $165 for a 90-day supply for a brand medication that's on the preferred list. In the HSA plans, you pay more. Until you've met that deductible, you're going to pay the full discounted cost of the medication. Same with the H5000. Of course, with the H2000 and H2500, the medications, once you've hit your deductible, you start paying the same co-payments as you see on the B1000 and the C plans. But in the H5000, you'll have met your out-of-pocket maximum once you hit your deductible, so you won't pay anything else for the rest of the year. In this brand example, same medication, well, the same type of medication, but this one's on the preventive drug list, you're going to pay that same copayment regardless of which plan you're in. So it's that same, and it's coinsurance, but with that cap, that maximum capped coinsurance. So $65 for a 30-day supply, $165 for a 90-day supply. So hopefully those examples made you want to take a look at that preventive drug list, because if you were afraid of enrolling in an HSA plan because you're worried about your medications being subject to the deductible, well, if it's on the preventive list, then they're not subject to the deductible. And I hope it also encourages you to take a look on OptumRx and see what the actual discounted costs of your medications are, because if you are on a lot of generic medications, they could actually be a lot less than this. Some of the generic medications that my family takes are only like $30 for a 90-day supply or $50 for a 90-day supply. And so then the difference I'm paying in premium to be on the lower cost HSA plans is a big enough difference that it's worth paying that full discounted price. All right, well, it's time to move on to the dental plans. Let's talk a little bit about those. Remember, we have 3 dental plans. The dental HMO, of course, only being available. You'll only see that if you actually have dental HMO providers in your area. So this is one place where we have different networks. The dental HMO has a different network than the other dental plans. It's the narrower Cigna Dental Care Access Plus network, whereas the 2 PPO plans use the broader Cigna PPO Advantage network. So that's important to remember. Not all dentists that are in the PPO Advantage network are also in the DHMO Cigna Dental Care Access Plus network. So you want to make sure if you're looking at the DHMO that your dentist is in this narrower network. The PPO plans do have a deductible of $50 per person. It's a different deductible than your medical deductible. It does not apply to cleanings and x-rays, so that's considered preventive. There's no deductible in the DHMO, and it's a lower cost plan as well. For the passive PPO, you get the same benefits whether you go in or out of network, whether your dentist is in or out of network. So you always have a $2,000 maximum benefit, pay 80% coinsurance. The plan pays 80% coinsurance, and you pay 20% after you've met your deductible. The PPO has more generous benefits for an in-network dentist, but less generous benefits for if your dentist is not in the network. So if you don't have a network dentist, you'll be better off in a passive PPO than you will be in a PPO. If you do have a dentist in the network, you'll be probably better off in the regular PPO. For the DHMO, there are only in-network benefits, and they follow a charge schedule. So there's no coinsurance or whatever. It's a fixed fee per service. But there is no out-of-network benefit in the DHMO. For the passive PPO and the PPO, you can either print your own ID card, or frankly, if you tell the dentist that you have Cigna, they can typically look you up. But if you choose the DHMO, you'll get ID cards mailed, actually a separate ID card for each person you enroll in the plan. And it will have their name and their primary care dentist on the ID card. You do have to choose a primary care dentist if you choose the DHMO, or one will be assigned to you. We do have a tool, it's available on Benefits Access, that helps you determine whether your dentist is in the DHMO network. So it instructs you through it. Remember, the HMO network is the Dental Care Access Plus network. The PPO network is the PPO Advantage network. All right, let's go to the vision plans. So we have 3 vision plans. I mentioned one, the Exam Core, is available at no cost if you enroll in a medical plan. And then we have 2 buy-up plans, the Full Service and Premier. So for all of these plans, the exam is covered. It's a $20 copay for a basic exam. It's the basic refraction. If you decide to have retinal photos, diabetes, eye care, etc., which is typically recommended at least every couple of years, that is an additional cost that then is covered by the $20 copay. They all use the same provider network, the VSP provider network. There's a couple of larger institutions that are in the network, as well as many smaller providers. Exam Core does not have any out-of-network benefits, so you need to see a eye doctor in the network. The Full Service and Premier technically have out-of-network benefits, but they're really reduced. So our strong recommendation is that you choose an eye care doctor that's in the network, in the VSP network. The Full Service plan offers $160 that you can use to spend towards glasses or contacts. You have to choose. The Premier plan is more expensive, but it gives each person $200 towards either 2 pairs of glasses or a pair of glasses and a pair of contacts. So $200 towards each, a total of $400. The Full Service plan also includes progressive lenses, pretty basic progressive lenses. Premier covers progressive lenses as well as UV protection, and you can get the anti-reflective coating for a $25 copay. So if you like glasses, you like many glasses, or you wear glasses and contacts, you might want to take a look at the Premier plan. VSP does not send out vision ID cards, but you can go online through Benefits Access, get into VSP, and print out your benefits. Or typically, I just have my eye doctor look me up, and they're able to find me. Because remember, you're going to choose a VSP network doctor. So if we go back to that plan comparison that we talked about earlier, so if you missed the opportunity with your QR code then, you have another opportunity now. So go ahead and scan that QR code and download our plan comparison brochure. It also has details about dental and vision plans. All right, well, we're moving along to the premium credit. Premium credit is really a way that your plan sponsor, maybe your employer, maybe your annual conference, maybe your local church, helps you pay for the cost of HealthFlex. So the premiums are different for each plan. We talked about the B1000 is the most expensive plan, the H5000 is the least expensive plan, and then we have 4 in between. But every month there's a charge just to be enrolled in the plan. And that charge also increases depending on how many people you cover. So there's a different premium for 1 person versus 2 people versus 3 or more. Your plan sponsor determines your premium credit, which they might choose to give you more money in the credit if you cover more people. Some plan sponsors do that, others don't. It does not vary based on which plan you elect. So you get that same premium credit regardless of which plan you elect. And you cannot use it to pay for personal account contributions like FSA or HSA contributions, but you can use it to pay for dental, vision, and medical plan premiums. If you choose plans that cost more than your premium credit, then you will pay the excess. So you will pay anything that exceeds your premium credit plus any personal account contributions that you elect. If you happen to choose a plan or plans that cost less than your premium credit, which is possible in some cases, not in all, Westpath will deposit any leftover premium credit into an HRA or an HSA, depending on which plan you choose, on a monthly basis. And I have some examples for you. So in this example, the premium credit is $800. Let's say that this person enrolls in single coverage in the C2000 plan, which costs $1,000. They choose the PPO dental plan, which costs $40. They enroll in the basic vision plan, which is $0. And they decide to contribute $100 a month to their FSA, flexible spending account. So their plan sponsor gives them $800. The total premium is the $1,000 plus the $40 for medical and dental, no additional charge for vision. So the total premium is $1,040 a month. The participant's portion, the amount that needs to be withheld from the participant's paycheck on a monthly basis, is $240. That's the amount that exceeded the premium credit, plus the $100 a month personal FSA contribution. Let's do another example. So in this case, the premium credit is $1,650 for 2 people. And this person chooses the H5000, which only costs $1,500 a month for 2 people. They decide to waive dental, and they choose that exam-only vision plan. They want to contribute $300 a month to their health savings account. So how does this all work? They have their $1,650 a month from their plan sponsor, but their total premium only adds up to $1,500 a month. So their portion on a monthly basis that needs to be withheld from their pay is only the personal HSA contribution, which is $300 a month. The additional credit that's left over, that extra $150 a month, that will also be deposited into their HSA on a monthly basis. So that person will get $450 deposited into their HSA each month. $300 from their paycheck, $150 from their leftover premium credit. Both of those things, as well as whatever would be included in the plan, it has to all be considered when you calculate the IRS maximum contribution for HSAs. All right, speaking of HSAs, let's move on to health accounts. So an important thing to remember is that 4 out of 6 of our plans include money in a health account at the beginning of the year. So just by virtue of paying 1 month's premium, you get this money in an HSA or an HRA deposited by WestPath. So the H2000 and the C2000, they both include $1,000 for if you cover one person, $2,000 if you cover 2 or more people. The H2000, it would be deposited in a health savings account. The C2000, it would be deposited in a health reimbursement account. The H2500 has $250 deposited if you cover one person, $500 if you cover 2 or more. And the C3000 is similar to the H2500. Again, the C3000, the money goes into an HRA. The H2500, the money goes into an HSA. You can also make personal contributions to an HSA, and you can make personal contributions to an FSA. So lots of good accounts to choose from, which really help offset your out-of-pocket costs. So let's compare these different types of accounts. The HSA and the FSA both have annual limits set by the IRS. We know the 2024 limits for the HSA. It's $4,150 if you cover just one person in an HSA plan, $8,300 if you cover more than one person in an HSA plan. And if you are over 55, you can contribute an additional $1,000 on top of that. There's no limit on the HRA plans, but only the employer can contribute to that, or only the plan can contribute to that. The FSA, these are the 2023 numbers. We haven't gotten the 2024 numbers from the IRS. Those usually roll out at the end of October or beginning of November, just in time. You can use your HSA and your FSA for tax dependents. Typically under 26 if they're or under 27 if they're a full-time student. If they're not a full-time student, then it's typically under 19. The HSA and the HRA, there is no limit to how much you can roll over. HSA forever, you can keep rolling it over, forever and ever and ever, and then when you pass away, you can pass it on to your beneficiaries. The HRA, you can keep rolling it over as long as you're still affiliated with your HealthFlex plan sponsor, either as an active or in retirement. And the FSA, it only allows you to roll over however much the IRS says you can. The $610 amount, again, is for 2023. The HSA, I mentioned, it's yours no matter what. You can leave it to beneficiaries. The HRA you only get to keep as long as you stay in HealthFlex or if you retire from your HealthFlex plan sponsor. If you terminate coverage because you leave the position, or if you waive HealthFlex, then you have 90 days to spend it down. And the FSA, you lose it as soon as you terminate or waive HealthFlex, and you can only make claims as of your last day in HealthFlex. Only the HSA has the ability to earn interest or dividends on the amount that you keep in the account, depending on how you choose to invest it. And then some interesting facts about each. So for the HSA, it is a true bank account, so if you're enrolling in it for the first time, you do need to make sure you accept the terms and conditions during the AE process. If they can't confirm your identity based on the information we send them, they may reach out. For HRAs, we do forfeit small balances, so if your balance is below 100, we will notify you and give you 90 days to spend it down. And the FSA, it's a little bit unique if you're also contributing to an HSA. And so if that's you, we have some custom pieces that are available for that. So health savings accounts are definitely something that we have been encouraging HealthFlex participants to strongly consider. They have huge tax advantages and allow you to pay medical expenses with pre-tax money. You can also accumulate funds. With HSAs, it just rolls over from year to year. So you can save money for future expenses, either in a few years or in retirement. The employer contributions in an FSA all contributions in an FSA are available on January 1st. Only the plan contributions in an HSA are available in full January 1st. So if you think back to that table a couple slides ago, I showed you 4 plans that included money. All 4 of those plans, the money is available in full at the beginning of January. When we did an analysis, we looked, de-identified, we didn't look at anybody's names, but we looked at claims over the years of people in HealthFlex without their names attached. And we found that 90% of participants in HealthFlex, year after year after year, would pay the lowest amount in an HSA plan. So we just strongly encourage you to take a look at those, and if it's a good fit for you, we encourage you to enroll in it because there's a real potential to save some money there. We do have two unique pieces. If you are approaching Medicare eligibility, there are some important considerations that you want to think about before electing an HSA plan, because once you're enrolled in Medicare, you cannot contribute to an HSA. The same is true if you're enrolled in Champus or TRICARE or Medicaid or under a spouse's plan that's not a qualified high deductible plan. And then there are some people that want to max out their HSA contributions, so they want to do the full $8,300 or $9,300 if they have family covered and are over 55 and still want to put more money in an FSA. If you max your HSA contributions, you may want to contribute to an FSA, so we have a special piece that's available that talks through those scenarios. Both of those pieces are available online on Benefits Access. So same plan comparison that we've been talking about this whole time. One more chance on the QR code. This plan comparison also has details about the different health accounts. So if you want a quick review of what we just talked about and a little bit more, go ahead and scan that QR code and you should be able to see some comparisons of the different type of health accounts. One thing to also remember with the health accounts is they come with debit cards. And so right now we have two different debit cards. In the future, we hope to be able to move to a single one regardless of which account, but I want to spend a little time telling you about which card you might use if you have more than one account. So if you have a health savings account with WestPath, you should have this purple and white card. And it does say health savings account on it, but it's small. It's in the upper left, right in the top of the purple part. So if you have a health savings account, you'll have this purple and white card. If you only have an HSA, you will use this card anytime you want to use your health savings account. But if you also have an FSA or leftover HRA money, then you need to use your HSA card for medical, pharmacy, and behavioral health expenses, and a teal card, which I'll talk about in a minute, for dental and vision. That's your limited use FSA or HRA if you're contributing to an HSA. Once you hit in 2024, $1,600 in expenses if you have single coverage, or $3,200 in expenses if you cover 2 or more people, then you can fill out a form, send it to Health Equity, say, hey, I've had this much in expenses this year. And then they will convert your FSA or HRA to full use, and then you can use your teal for everything. And you want to do that because you want to, your HSA you can keep forever, but your HRA and your FSA you don't necessarily get to keep forever. So use your teal card as soon as it's converted. Some of you already have this teal card. Now, if you're new to HealthFlex, or if you lose your teal card and you need a replacement, just so you know, it's being replaced with a solid purple card. So that teal card or solid purple card, that's for your FSA or your HRA. If you only have an FSA and an HRA, you would use that card for all expenses. But like we said before, if you also have an HSA, you'll start out using the purple and white card for medical, pharmacy, and behavioral health, and the teal card for dental and vision. And there is a picture of the purple card, the solid purple card, that's replacing the teal card going forward for any new people. And we really are hopeful that that purple card, that solid purple card, will eventually be for all accounts, maybe sometime in 2024. We also have the dependent care flexible spending account. This is not for like healthcare expenses for dependents, it's for childcare expenses or adult daycare expenses for a dependent adult. So it's different, it doesn't have any of those cards associated with it. There's no rollover, you have to use it in the same year you contribute. If you leave HealthFlex, you can only use it on claims as of your last day in HealthFlex. It can only be used for children under 13 or adult disabled dependents. And then the annual limit is $5,000 contribution. And if you have you and a spouse that are both eligible to contribute, you can each only contribute $2,500. and it's available on the 5th of the month when it's deposited each month. All right, well, I hope that that was a helpful overview of the different types of accounts that are available for HealthFlex. Now let's talk about how you go about making your decisions for 2024, because that November 1st through 16th time frame is going to be here before we know it. So you've heard me mention this little guy before. Alex Benefits Counselor is a little cartoon that's available in an online tool. He's designed for annual election, and this tool helps explain confusing healthcare topics in simpler language, probably simpler and funnier language than I'm able to provide for you here today. It takes about 30 minutes to run all the way through it, but you don't have to run all the way through it if you don't have 30 minutes. And it gives you a personal recommendation for plan choices, what the lowest cost plan choices will be, as well as how much you might want to contribute to health accounts for 2024. And we think he's funny. A little dad joke humor, but still pretty funny. Alex does know your premium credit. That's preloaded into Alex. You do have to tell Alex what kind of an employee you are. Are you an actively working clergy? Are you a lay employee at a conference office? Are you a lay employee working at a different location? Are you retired? Are you a surviving spouse or dependent? Or are you on leave? So for some plan sponsors, your premium credit varies based on those. So make sure you tell Alex the correct category of your work. And then Alex will recommend a plan. When I mentioned before, I kind of put everything in an Excel spreadsheet, but Alex kind of does the spreadsheet work for you. So you have an opportunity to say what type of care you think you'll receive in 2024, and then he crunches the numbers. The blue is how much you pay to be on those plans and premiums. The green is how much they estimate your out-of-pocket costs will be, and that does consider how much you get in an HRA or HSA. And then Alex also does that worst case scenario, and that's the red bar, and that says, okay, if it's the worst and you hit the out-of-pocket max, what are you going to pay? Now you may be asking, hey, I thought you said the out-of-pocket max is the same for all plans. How come the worst case scenario isn't the same for all plans? Well, the reason is because the premium isn't the same for all plans, and the amount you get in health account contributions isn't the same for all plans, which is why you really need to consider all three of those when you're choosing your plan. And then Alex also explains the tax benefits of health account contributions and helps you figure out how much you might want to contribute based on what you told Alex you might need in care in 2024. And just as a brief kind of overview of how the tax savings works, I hope this encourages you to contribute to a health account, either a flexible spending or a health savings account. So let's say you make $40,000 and you pay 20% in your federal income tax. If you take $2,000 of that and contribute it to an HSA or an FSA, then you only pay tax on $38,000 instead of the $40,000, and that's $7,600 in tax. But if you don't contribute that $2,000, then you'll pay the 20% tax on the full $40,000, which is $8,000. So you contribute $2,000 and end up saving $400 in tax savings. That means you basically got $2,000 of HSA or FSA money at only $1,600 cost to you. Just something to think about. This is just an example with one tax bracket. You can do the math and calculation with yours. We have our OptumRx drug pricing tool, which should be available any day now, also on Benefits Access. I think it's helpful because if you're considering an HSA plan, it can give you an idea of what that full discounted cost of your medication might be. It also takes into consideration whether your drug is on the preventive list. So both the preventive list and this pricing tool are good resources to use to help you price your drugs under different plans. We've heard in the past that some people don't want to choose a plan with a high deductible because they think to themselves, well, if I don't hit the deductible, then why do I even have health insurance? But there are benefits that you get before you even meet the deductible. So first of all your wellness checkups and preventive screenings are covered at 100%. So you can go get your doctor's visits and your mammograms and your colonoscopies covered at 100%, regardless of which plan you choose, before you even met your deductible. All of our plans include MD Live. Those are the virtual visits like for acute care, like acute needs, like an ear infection or a rash, or for behavioral health visits. The plan will pay for that even if you haven't met your deductible. You get discounts on services and medications, and sometimes those discounts are sizable. So again, even if you don't meet your deductible, the amount you may be paying, that discounted cost may have significant savings over if you didn't have a plan at all. We talked about the rebates, and we do give you the advantage of the rebates in your discounted cost. And all the preventive drugs also bypass the deductible. So if you choose an HSA plan and you're on preventive medications, the plan will help you pay for those even if you haven't met your deductible. So lots of reasons to at least think about considering a plan with a higher deductible. I've mentioned benefits access a few times. This is a different QR code, and it should take you directly to a benefits access login page. And if you log in, you should be able to get specific information to you about annual election. This is for primary participants only. Dependents, spouses, children are not able to access and log in to benefits access at this time. If that's you and you're a spouse who's listening or an adult child who's listening, you can go to our public annual election webpage for basic information about the plan options, tools, resources, and many of the links that we've discussed today. All right, well, we're almost done. Now to the most important part, which is actually what are you supposed to do between November 1st and November 16th? Well, you'll go back to Benefits Access. Again, it's the primary participant, the employee who goes to Benefits Access and logs in, and you'll see a link that says select your 2024 HealthFlex benefits now. When you walk through it, the premium credit will be automatically applied once you select a medical plan. You'll see that fixed dollar amount that you can use that will be applied to your premium, and it appears as a monthly credit towards the cost of your plans. It does not apply to personal account contributions, and it's assigned based on how many people you cover in medical. So if you cover one person in medical, you'll get your plan sponsor's single premium credit. If you cover 3 or more people, you'll get your plan sponsor's family premium credit. It is technically possible to waive the premium credit. Unfortunately, that's something that we couldn't change, so I will just say to you right now, please do not waive the premium credit. You want the premium credit. We'll try to find you if you waive it, and we'll try to correct it for you, but just don't waive the premium credit because I know you all want your plan sponsor's money to help you pay for health benefits in 2024. All right, so now through November 1st, go to Benefits Access, look at our information. If you didn't attend one of the other webinars, go ahead and attend those. Listen to our benefit bites. They're all available on Benefits Access, and visit Alex. Now, Alex does not enroll you in your plans, so come November 1st, come back to Benefits Access and make your 2024 elections. That's when you choose your plans, who you're going to cover, your personal account contributions. If it's the first time you're enrolling in an HSA, make sure you accept the terms and conditions. And if you're choosing the dental HMO, make sure that you follow the directions to choose your primary care dentist. If you do not, come in to Benefits Access and make your elections this first couple weeks of November. Remember, if you've already been enrolled in HealthFlex, you'll be enrolled in the same plans as you had last year. Unless you're in an HSA plan, then you'll be enrolled in the most closely associated HSA plan as determined by us. Or if you haven't been in HealthFlex before, you'll be enrolled in your plan sponsor's default plans. You will not have any personal FSA or HSA contributions for 2024. If you need additional help, we do have an AE support center. They can give you basic information about the different plans and help remind you some of these differences about the different types of health accounts. They are available Monday through Friday from 7 a.m. to 7 p.m. Central Time. The phone number is on the screen. If you call the main WestPath number, there are also prompts in our IVR on our phone recording that will get you to the Annual Election Support Center. Here are some common mistakes that we hope that you'll avoid having attended this session today. It's a mistake to not use Alex. Even if you've used Alex before and you think you know what Alex is going to say, we have 3 new plans this year. You should use Alex, and you should take a look and see what the lowest cost plans will be for you this year. Thinking Alex is all you have to do. So Alex does not make your elections. So even if you go through Alex, make sure you also go through Benefits Access and actually make your elections from November 1st through 16th. If you're clergy, be careful not to write a different FSA or HSA contribution on your charge conference form than you enter during AE. WestPath doesn't see your charge conference form, and so it just causes some confusion at your local church and for your conference office. Don't choose the DHMO unless you're prepared to select an in-network primary care dentist. If you are electing the HSA for the first time, make sure you approve the terms and conditions, or we won't be able to open the account on your behalf. And if you have children who are over 13 and over, you don't want a dependent care FSA. You're not allowed to have it unless it's a disabled older child. If you have health expenses for your dependent, you should use the Health Flexible Spending Account or the HSA. All right, so right now, Alex is available. The OptumRx pricing tool should be available in the next day or so, and then you have access to all of these webinars and recordings, the ones that have already been done. We have some Q&A sessions coming up in the coming weeks during AE. From November 1st through 16th, you should make your elections, and Alex will still be available, so if you want to visit Alex again, you can always go back. In December, everyone will get a new HealthFlex medical ID card. It will have Blue Cross and WestPath on the front, and it will have Quantum Health's name and phone number on the back for your care coordinators. If you're enrolling in a dental HMO, you'll get an ID card mailed, and if you're enrolling in a health account through Health Equity for the first time, you may also get those cards in the mail. And before we know it, it will be January of 2024. In January, you can start using your benefits. You can use your well-being programs. You can actually call the care coordinator if you need help with anything related to your benefits. And so many great things ahead in January 2024. You just want to make sure you set yourself up for success by going through annual election in November. Well, thank you for your time today. You know, things that we think that you're really going to love about HealthFlex this year. We think you're going to love Alex. You know, I hope you give it a try if you haven't in the past. It's a great tool, and especially this year when we've had plans change, it's really important to take a look and see what plan might be best for you. We think you'll love the flexibility of HealthFlex to choose the right combination of plans for your household. Lots of choices for dental and vision to really right size and meet the needs of your family. And more opportunities for tax advantage money like through health savings accounts. So we'll hope you'll take a close look at those too. All right, well, thanks everybody for bearing with me today. We do have the opportunity to take some questions. We have a good amount of time to take some questions, so I'm gonna go ahead and open up that. So if you've already entered your questions, they are probably coming through. And if you haven't, this is a great opportunity to go ahead and enter those in the question and answer box. So somebody asked, what does the phrase no individual deductible if more than one person is covered mean? So if we go back to that slide, it's the slide where we compared the C2000 and the H2000. We talked about in the H2000 and the H2500 that if you cover more than one person, there's no real individual deductible. And what that means is that the family deductible always applies in the H2000 if you have multiple people covered and only one person has expenses, that person still needs to meet the $4,000 family deductible before the plan starts paying its coinsurance. So that's really what it means. If you cover more than one person in the H2000 or the H2500, you always have to meet that full family deductible before the plan starts paying for its coinsurance. If the prescription is not on the formulary, does the cost count towards your deductible? So if your prescription drug is not on the formulary, then HealthFlex doesn't cover that drug. Now, there are some times where you have to take a drug that's not on the formulary for certain clinical reasons you can't handle, or the alternatives that are on the formulary don't work for you. I encourage you to work with either OptumRx or in January, your care coordinator through Quantum Health to try to work through that process and see if you might be eligible for an exception. But if it's not on the formulary, it's not covered and it does not count towards your deductible or your out-of-pocket maximum. Somebody asked, where can you find the preventive drug list? So you can go to that website, which I believe is welcome.optumrx.com/westpath. It was on the slides, but it's also available in benefits access. So if you go follow the links for the pricing tool, you can scroll down and you'll be able to see the preventive drug list. The 2024 list is available, as well as the 2024 formulary on that. So we definitely encourage you to visit benefits access and find that link and go ahead and see if your drug is preventive and make sure that your drug is on the formulary. Can we use the HSA to pay for vitamins, supplements, first aid, and home health care products? So both the HSA and the FSA are guided by the IRS and their rules as far as what can be covered. I definitely encourage you to go to Health Equity's site and look and see what types of expenses are covered. There are some over-the-counter things that are covered. Some require your doctor to prescribe them, and some things are not covered even if your doctor does prescribe them. Where do you get the link to Alex? Well, if you are a primary participant or an employee, then you can get to Alex through Benefits Access. So go to benefitsaccess.org, log in. It's the same place you go for health and retirement benefits if you have those with WestPath. And then if you click on that annual election Learn More link, you will be able to access Alex directly there. If you are not a primary participant and you can't get into benefits access, I encourage you to reach out to your plan sponsor. Your conference benefits office, your HR department, they have your Alex specific link that's specific to you. Some vaccinations are covered through pharmacy benefits. The RSV vaccination is covered through medical. Why is there a difference? Good question, and actually something that we're looking at right now. The RSV vaccines are quite new, and the rules and requirements around them are still evolving. They are actually not considered 100% preventive like flu and COVID vaccines because clinical recommendations and clinical guidance is encouraged rather than just the whole population being recommended to get them. For that reason, OptumRx hasn't been covering them at the pharmacy benefit, so Blue Cross has been covering them and United Healthcare. We are taking a look at that because we understand that many medical providers are not providing the RSV vaccine and they're sending people to pharmacies. And so as long as that's the case, we are going to evaluate what the best way to give people access to that vaccine is, if it is indeed recommended by their physician. So stay tuned. Where can you find the other HSA webinars? So if you are currently in an HSA plan, you can go into Benefits Access and again, click that Learn More annual election link. And if you scroll down, those HSA webinar recordings are posted at the bottom of that page. If you are not already in an HSA plan, I encourage you to reach out to WestPath. You can contact us at healthteam@westpath.org, or you can reply to the invitation to this webinar or to the follow-up to this webinar, and we'll be happy to send you those links to the recordings for the HSA webinars. Is MD Live a special portal to access telehealth, or does it cover telehealth by all covered providers? So MD Live is a specific vendor that WestPath contracts with, and they have a network of providers that provide telehealth services. You can get to MD Live through Benefits Access. So if you go into Benefits Access and go to the Health tab, you should be able to click on MD Live. It will, through a single sign-on, no additional username and password, it should log you into MD Live, and you can choose to access that service at $0 cost. Currently, we are not covering all telehealth at $0. We don't have quite as much flexibility to do that for all plans. My husband is retired and I'm his dependent. Does he log into westpath.org to elect the plan choices? So if your husband is retired but the primary participant and you are still on HealthFlex coverage, yes, your husband would need to go online and access all the information. Another option would be to call. For folks who are retired, not all folks who are retired are going to be able to work through the process online. You should have received, if that's you, a special postcard that actually says that you need to call the AE support line to make your election. Are there presentations for those nearing Medicare age? So we have not had a specific webinar for people reaching Medicare age. Our HSA presentations did discuss and have some Q&A for folks who are approaching Medicare age. I really feel like the most useful tool that we have for you is that handout that I mentioned that's available on Benefits Access. It's about HSAs and people approaching Medicare. If you are approaching Medicare and you enroll in a non-HSA plan, it really shouldn't have an impact for you. But if you are thinking about an HSA plan, you do want to think about when you turn 65, when you'll be enrolling in Medicare, because that impacts how much you can contribute to your HSA. Is acupuncture covered in the HSA plans? Actually, acupuncture is covered by all of our plans. If you look in that plan comparison, there's a section on alternative therapy, and it talks there about how acupuncture, massage therapy, chiropractic care is covered. It is covered under all of our plans. Cost of hearing aids is high. Will the H2500 cover hearing aid expenses? If so, how much? There is a hearing aid section in the plan comparison. I do encourage you to take a look at that and compare. Each of the plans cover hearing exams and hearing aids to some extent. Of course, remember that the deductible in the H2500 is higher, and so there would be more out-of-pocket expense before the plan kicks in. Is there a way to get more personalized advice, more personal than Alex, for those who are really struggling to determine the best plan and understand how the HSA works? We are not set up to provide individual consultations, and we can't tell you what plan to enroll in. But if you do have specific questions that you feel haven't been answered in this webinar or this setting, or it's too personal, we do encourage you to go ahead and follow up to the email you receive following this webinar with your question, and we will get you to the right person to help you answer it. All right, I have a temporary pause on questions, and so we may be running out of questions, which is totally fine. Like I said before, if you have additional questions after the fact, you will get a follow-up email to this webinar, and you will be able to, you can ask questions there. You can contact WestPath through regular means. You can contact the e-support center. So we do have a lot of ways for you to get in touch with different individuals. Oh, there are more. So we're gonna keep taking those. We have a couple more coming. We still have 15 minutes to answer questions. So please keep them coming, and we'll do our best to answer them. All right, here's another one coming in. Does the fact that we'll be retiring during 2024 change the way we choose our insurance or the kind we need? It probably depends on if you're retiring and you're already 65 or you're retiring before you turn 65. If you're already 65, you'll want to think about those Medicare considerations, because if you're retiring in 2024, then you're also approaching Medicare eligibility. So you'll want to make sure you think about that. If you're retiring and you're under 65, then I think you probably just want to think about from the health account standpoint, what happens to the health accounts after you retire. If you have an HSA, you get to keep the health account into retirement. The HRA, if you're retiring from your HealthFlex plan sponsor, you get to keep the health account into retirement. But your FSA, once you retire, after your retirement date, you no longer have access to that FSA money for new claims. You can only submit claims that were incurred prior to your retirement date. So those are the kind of things that you'll probably want to think about if you're retiring in 2024. Good question. While we're waiting for the other ones to come through, Again, just wanted to remind you all, we had those 3 HSA-specific webinars earlier in the week. Those recordings are available on Benefits Access if you are enrolled in an HSA plan in particular. We have some more webinars coming up. If you go to the WestPath events page, we've got a general Q&A webinar, a pharmacy-specific Q&A webinar, and we also have a specific webinar for folks who are with one of the 7 conferences that currently is with UHC. We don't have a lot to share on those, but we do want to open it up if people have questions. So we will take turns answering those questions on those webinars that are upcoming. Here's another question. Can you use your HSA to pay for non-Medicare premiums if you retire early? I believe the answer to that is yes. We will follow up with that one after the fact. But your HSA, once you retire, you can use it more generally for premiums than you can before you retire. Lots of really good questions here. You know, I know health benefits can be really complicated. In addition to all the lingo that we shared at the beginning, there are really a lot of unique things about the way things work, and it's not inexpensive, right? Like it's something that costs a lot of money, and it can be really complicated. We are really excited to introduce those care coordinators in 2024. It's not going to make healthcare less expensive necessarily, although the care coordinators may be able to help find less expensive options if they are out there. But I hope that it'll make it easier, less stressful. Take you out of the middle of being the go-between when Blue Cross and your provider are trying to work out a prior authorization, or OptumRx and your provider are trying to work out a prior authorization. I think that's going to just be fantastic, and it will hopefully reduce stress for a lot of people. The dentists in the area don't accept Cigna. What should you do? The passive PPO is probably the best plan for an individual who doesn't have a good in-network dentist option. Some zip codes, depending on how rural a zip code is, has more dentists that are available in the networks than others. Certainly some of those in-network dentists may not be taking new clients. So if you cannot find an in-network dentist, then the passive PPO plan is probably the best plan for you. I will be 65 next year. Is it required that you apply for Medicare, or can you put it on hold, and for how long? So definitely I would reach out to your plan sponsor and CMS, but very broadly and typically without knowing your specific situation. If you continue to be actively working past 65, you don't have to apply for Medicare immediately. You are able to delay Medicare as long as you continue to be actively working and without incurring a penalty down the road. So, like I said, every situation is a little bit different, but in general, if you are still actively working, you can remain on the active HealthFlex plan that's offered by your employer, and you do not have to enroll in Medicare to avoid a penalty until you stop working. Where can you access Alex prior to November 1st? You can access Alex in Benefits Access today. So go into Benefits Access today, so benefitsaccess.org, and you log in, and you can go to that. There's an annual election button. You hit Learn More, and you should be able to find Alex right in there. If for some reason you cannot find it in Benefits Access, and you can get in, then I encourage you to call WestPath. If you cannot access Benefit Access, or if you're like a spouse or a covered dependent, I encourage you to reach out to your conference benefits office or your HR department. They will have your specific Alex address that's specific to your plan sponsor available now. Is this webinar being recorded, and will it be available? Absolutely. You may not want to listen to my voice 10 times, but if you want to grab the recording and kind of fast forward and review a certain part again, you absolutely can do that. Share it with your friends if you found it helpful. I hope you did. So we will send out this recording as a follow-up to everybody who registered, and we will also make it available again on Benefits Access and in follow-up emails to the rest of the HealthFlex population, because we hope it's helpful. We hope it gives you some new information, and we want to make sure that you can listen to it even if you're listening to it after the fact. All right, so this question, they have the DHMO, the website listed multiple dentists taking new patients, and then they found later that they weren't taking new patients. Is there any chance that changing the dental plan will have a better result? Well, the dental HMO is a narrower network than the dental PPO and passive PPO. So yes, there will absolutely be more dentists in the network for the PPO plans than there are in the HMO plans. And some zip codes just have better depth of a dental HMO network than others. So if you're finding that it's not a good fit for you in your zip code, I absolutely encourage you to take a look at a different plan for 2024. For the individual who has the hearing aid question, it sounds like you have a pretty specific question. So if you could just follow up, we'll follow up with you after, and if you give us a day or two following this webinar to follow up with you, and then we will. If we don't answer your question in a day or two, you can always contact Westpath directly. But that's a pretty specific question. Lots of great questions. We've got about 5 minutes left. Just so everybody knows, if we don't get to all of the questions, which we certainly will try to do, we do get a list of the questions and who asked them after the fact, and we will absolutely follow up with you after the fact about your specific question if we don't manage to get to it on the air, so to speak. Somebody's turning 55 in 2024. Does that change anything when it comes to the HSA? Well, if you turn 55 in 2024, then you can actually contribute the higher amount. So 55, if you are turning 55, you can contribute the higher amount. If you're turning 65, it really depends on if you are enrolling in Medicare this year. So it's the actual enrollment in another plan that determines whether or not you can still contribute to an HSA. And that's really because of IRS rules. The IRS gives pretty significant tax savings for HSA contributions. We talked about the family contribution is up to $8,300 for 2024. So it's a sizable tax deduction, or not tax deduction, tax advantage. And so the rule is you can't be in a plan that pays before a certain level of deductible is met. So you can't be in Medicare, you can't be in TRICARE, can't be in Champus, and you can't be in another plan through a spouse or another means that's going to cover before that qualified deductible is met. But if you're 55 and you can afford that extra $1,000 HSA contribution, go for it. There's, great opportunity to save for future expenses in retirement. We didn't talk about the triple tax advantage of the HSA, but you don't pay tax on the money you put in. You can earn interest and dividends, so that money can grow, and you don't pay tax as the money grows. And then when you take it out, even in retirement, if you take it out and use it for a healthcare expense, you don't pay tax on what you take out. Now, if you take it out and use it to, go on a vacation, then you pay tax on it, but just normal tax if you're retired. But if you use it for a health expense in retirement, then you don't even pay taxes on it then. So that's a triple tax advantage. Pretty great. Can a person have more than one HSA? My spouse is eligible for coverage for the first time this year, and he has used our joint HSA previously. So you can contribute to more than one HSA account, like as an account. You could have, you can have multiple bank accounts, you can have multiple HSA accounts. But the annual limit applies across all accounts, all contributions. So you do need to be prepared for that. You need to consider the annual limit when you're thinking about multiple accounts. This individual has individual coverage for a spouse who's still working. The primary participant is on Medicare and a supplemental health insurance plan. Do the person on Medicare's medical costs count towards the minimum deductible, the minimum IRS deductible? And they do not. It's just for the person who's in the HSA. So if you've got a family who's split and you've got individual coverage in an HSA plan and you're wondering, can you convert that FSA to full use early? You still have to that person has to meet the $1,600 in expenses. Will there be handouts from this session? So as a follow-up to the session, you will get an email with the recording. You'll get an email with the slides. All the same email with the recording and slides. And then the handouts we mentioned in the presentation, we'll make sure to attach those as well. All right. Well, I think it's time to wrap up. Wonderful questions. Thank you all so much for your attention and your engagement. Like I said, if we did not get to your question live, we absolutely will we will absolutely follow up with you after the fact, especially if your question is more of a personal nature. So we'll work on following up with you in the next couple of days. Thank you all for being here today, and please don't forget, go into Benefits Access and make your annual elections for 2024 from November 1st to November 16th. Thank you. Have a great day.
Clear.
Yes.
Nice job.
Holy cow.
That's a lot.
Was a lot.